Importance of taking your medication as prescribed. Taking medication as prescribed is crucial for managing various health conditions, including chronic diseases, acute illnesses, and mental health disorders. Adhering to medication regimens can help individuals achieve optimal health outcomes, prevent complications, and improve their quality of life. In this article, we'll explore the importance of taking medication as prescribed, the consequences of non-adherence, and strategies for improving medication adherence. Why taking medication as prescribed is important. Taking medication as prescribed is essential for several reasons. 1. Effective treatment. Medications are designed to treat specific health conditions, and taking them as prescribed ensures that the medication is working effectively. 2. Symptom management. Medications can help manage symptoms, such as pain, inflammation, or anxiety, and taking them as prescribed can help alleviate these symptoms. 3. Preventing complications. Non-adherence to medication regimens can lead to complications, such as disease progression, hospitalization, or even death. 4. Improved quality of life. Taking medication as prescribed can improve overall health and well-being, enabling individuals to engage in daily activities and maintain their independence. Consequences of non-adherence. Non-adherence to medication regimens can have serious consequences, including 1. Treatment failure. Non-adherence can lead to treatment failure, which can result in disease progression or worsening symptoms. 2. Hospitalization. Non-adherence can increase the risk of hospitalization, which can be costly and disrupt daily life. 3. Increased healthcare costs. Non-adherence can lead to increased healthcare costs, as individuals may require additional medical interventions or treatments. 4. Decreased quality of life. Non-adherence can decrease quality of life, as individuals may experience worsening symptoms or reduced functional ability. Strategies for improving medication adherence. Several strategies can help improve medication adherence, including 1. Simplifying medication regimens. Simplifying medication regimens can make it easier for individuals to take their medications as prescribed. 2. Using reminders. Using reminders, such as pill boxes or alarms, can help individuals remember to take their medications. 3. Enlisting support. Enlisting support from family members, friends, or healthcare providers can help individuals stay on track with their medication regimens. 4. Monitoring side effects. Monitoring side effects and reporting them to healthcare providers can help individuals manage their medications and adjust their regimens as needed. Banner Health's approach to medication adherence. Banner Health, a leading healthcare provider, recognizes the importance of medication adherence and has implemented various strategies to support patients in taking their medications as prescribed. These strategies include 1. Medication therapy management. Banner Health's pharmacists work with patients to manage their medications and ensure that they are taking them as prescribed. 2. Patient education. Banner Health provides patient education on the importance of medication adherence and how to take medications correctly. 3. Support services. Banner Health offers support services, such as counseling and support groups, to help patients manage their medications and stay on track. Conclusion. Taking medication as prescribed is crucial for managing various health conditions and achieving optimal health outcomes. Non-adherence to medication regimens can have serious consequences, including treatment failure, hospitalization, and decreased quality of life. By understanding the importance of medication adherence and using strategies to improve adherence, individuals can take control of their health and well-being. Banner Health's approach to medication adherence is a model for healthcare providers, highlighting the importance of patient education, support services, and medication therapy management. Recommendations. If you're taking medication, here are some recommendations. 1. Take your medication as prescribed. Take your medication exactly as prescribed by your healthcare provider. 2. Use reminders. Use reminders, such as pill boxes or alarms, to help you remember to take your medications. 3. Enlist support. Enlist support from family members, friends, or healthcare providers to help you stay on track with your medication regimens. 4. Monitor side effects. Monitor side effects and report them to your healthcare provider to manage your medications and adjust your regimens as needed.